Hello and welcome. Doctor, I have a really bad smell in my nose. What could the problem be? What should I do? And which doctor should I see? I get asked this question a lot on the channel. Look, this issue of a bad smell in the nose, we divide it into two categories. The first category includes diseases and problems where there is actually a bad smell that the person is smelling and complaining about. The second type, or the other set of causes, is when there's no smell at all and the person is complaining without there being an actual odor. They are smelling a scent that isn't there. Okay, for the first category, when there is a smell, what could be its source? What could be the cause of this bad smell? Many things. Some are nasal diseases, which we'll talk about in detail after we discuss the diseases from outside the nose. A smell coming from a place other than our nose. The most common source is the teeth. If someone has a problem with a tooth, a decayed tooth, or has some form of gum disease, or has pockets where food collects between the teeth, this food ferments and creates an unpleasant smell. Also, if they have chronic inflammation of the tonsils, secretions and food debris can collect in them. That also creates a bad smell. This is easy. We check with a dentist or an ENT doctor checks the tonsils if there's a problem there. Also, if the smell is coming from the stomach or the colon, if the person has problems with their digestive system, that's also one of the things that creates a bad smell that the person smells and is bothered by. There are also many diseases that do this. For example, diabetes. Uncontrolled diabetes, when blood sugar rises, can cause such problems and create an unpleasant smell in the breath. Also, kidney diseases and liver diseases. Sometimes they are indeed associated with a bad smell that the patient smells and is bothered by. And we know that these chronic diseases can have this effect. So if the patient is complaining of one of these diseases, we run tests to see if complications from the disease have occurred and if that's what's causing the smell or not. Also, many times it's things we don't really pay much attention to, like the nature of the food itself or foods that have a strong odor, like onions, garlic, and many things like that, and certain spices used in cooking. Sometimes they create an unpleasant smell in the breath because they are expelled from our body. These spices, seasonings, and food substances are expelled through our breath. So these are diseases or problems located outside the nose where there's a real bad smell that the person perceives in their nose. Alright, are there diseases within the nose itself that create an unpleasant smell for the person? Yes, of course, there are many. The most common ones are categorized by age. For instance, if a child complains of a bad smell in their nose, the first thing we think of is a foreign object lodged in their nose. A foreign object will cause a bad smell and discharge from one side. We can easily see it with an endoscope or during an examination, and once we remove it, the problem is resolved. Okay, what else in children can cause a bad smell? Adenoids. The presence of adenoids for a long time can also cause nasal secretions to accumulate and not drain easily, which in turn leads to a bad smell. In a slightly older age group, we also see problems like fungal infections. Fungal sinusitis that persists for a long time can create an unpleasant smell that the person also perceives and is bothered by. Another very common issue in the middle age group or those older than children involves problems with the teeth, specifically the upper molars. The first and second ones. When there's a problem like decay or when we remove them, a fistula can sometimes form between the removed tooth and the sinus located beneath the eye. As a result, food, secretions, fluids, and similar substances can escape from the mouth into the sinuses, where they ferment, causing the person to smell an unpleasant odor. Furthermore, in older individuals, we become concerned about nasal problems that also cause odors, namely tumors, because God forbid. Tumors can also cause a bad smell, along with blood, secretions, and things like that, resulting in an unpleasant odor. So, in short, if there is a real smell that the person is perceiving, it's either in their nose for the reasons we've mentioned, or it's in their teeth, their digestive system, due to chronic diseases, or from a specific food they regularly eat. Alright, doctor, is it possible for there to be no actual smell, yet the person perceives a bad odor in their nose? Yes, this happens quite often. One of the most common instances of this occurs in women. Pregnant women sometimes come in and describe what we call cravings, where the pregnant patient smells a strange odor in her nose that isn't actually present. Meaning, she might smell a specific dish, a particular fruit, or something that isn't present, and it's said that she's having a craving. This is the effect of the hormones released during pregnancy on the olfactory center in the brain. So the person imagines they're smelling a certain scent. They'll say, I'm smelling a scent in my nose, I'm smelling a scent in my nose throughout the pregnancy, and I want you to bring me the thing I'm smelling. This happens. There's no smell, but the person is smelling a specific scent in their nose. Also, diseases of the olfactory area in the brain, the olfactory center in the brain, if it's affected by a disease like some types of epilepsy, some types of inflammation, and also tumors that occur in that area, they change the sensation that happens in the olfactory center in the brain. and consequently, the person might smell odors that aren't there. Also, one of the most famous things that happened and that we went through in the past stages are viral infections of the nose. When someone gets corona or a severe flu, we used to see it before corona with the flu. A person's sense of smell would stop, they wouldn't smell well. Sometimes, also in the recovery stages from this loss of smell, when the sense of smell starts to return after being infected with viruses like corona and severe influenza, they say that before the sense of smell fully returns, meaning it gets better, the person feels like they're smelling something unpleasant. They often describe it as being like smoke or like blood, a bad smell in their breath. This is because the olfactory nerves were somewhat affected by these viral infections. And during the healing process, there's a bit of a mix-up in the nerve fibers that transmit smell. Consequently, they carry incorrect signals, meaning we might be smelling one scent, but the brain perceives it as a different one due to these nerve issues. It takes some time and then it goes away. And we actually consider this a sign. When someone who lost their sense of smell starts to perceive unpleasant odors, we tell them, that's great. It means you're healing and you'll be able to smell properly soon. In any case, as I've explained, that's how we approach the issue. And I hope this helps every patient understand the cause of their complaint. If you like these videos, please give them a like and subscribe to the channel so we know you're waiting for new videos from us. And I wish you all the very best of health.